Hello, everybody. I'm Dr. Dolores Fazzino. I'm a nurse practitioner, and I am also an assistant surgeon, and I also am a medical intuitive, and I also read energy very well. And I've been in the healthcare industry for well over 42 years. I still have a clinical practice and a coaching practice. And I help people heal in ways they never thought possible by helping them look at the issues around their beliefs, their um, thoughts, and their connectedness to themselves to remove some of those blocks and realign them so they could have true health and lasting wellness. Well, that's an interesting question, and it's also something that I've observed over time. Even though I am not technically an employee of the institution, I am an independent contractor at a lot of different hospitals in the United States in Southern California. And I've just noticed that sometimes when I go into some of these operating room or theater settings, that a lot of times there's an energy in the department, and you could tell a lot by the feel of the department. That's what I mean by energy. It's like the feel of what's really happening and how happy people are, and how things are going. It doesn't take long for me to get a energetic picture of what's kind of going on within that department. And so what I found over my many years of being in the clinical setting is that a lot of times the structure within the institution, especially in departments, they have what they call self-governance, where it's like you have a hierarchy of supervisors, managers, directors in a department, and there are subsets of the bigger institution. And what I've found is that sometimes what is happening in the department stays in the department, and the higher ups don't really know what's going on. Yet, issues that are within the department knows about it, yet fails to deliver any type of shift or change. And what we know is that what you resist or ignore persists. So, ignoring it is not going to make the problem go away. A lot of times it makes it bigger. And I find that sometimes what happens too is that the morale of the staff gets diminished. There is, maybe some workplace bullying, harassment, a lot of negative stuff that kind of gets pushed underneath the carpet and never really dealt with. It's like the elephant that remains in the room, that nobody wants to talk about, but yet is there. What I also find too is that, what really, who it really affects is really the patient and the patient care. Because if you have people who are um, uh, maybe resistant to change, but also may not be um, there for the right reasons, or their behavior has been allowed to perpetuate without, maybe it was addressed, but it was, no changed or witnessed behavior has been um, observed. A lot of times there's resentment in the department, and I feel energetically that just affects patient outcomes. Bottom line, we're there for the patient. And, when the patient isn't the first priority and people think that things are compartmentalized in boxes where it doesn't affect the patient, I think they need to be educated to realize that everything affects everything. It's like the law of physics. It's something that needs to be addressed, because I think that what's happened is that with the I guess this dissemination of the governance within an organization, they keep everything within the departments. Is that, a lot of times you have the department, and then you have the I call it the C-suite, or the high administration people. They aren't concerned about the little daily issues, and that's why they keep it as a subset. However, when it is affecting the morale, it's just like, and nothing is getting done within the microcosm of the macrocosm, is that, it affects, the institution's bottom line, because a lot of times, sometimes mistakes are made. Also, there's workplace harassment that here in the United States, we have zero tolerance for that. But the thing is, the organization needs to be made aware of it. And so if it's kept within the department and it's not shared with the upper realms, meaning that if, you have leadership that's not very strong and very motivated to, I'm going to say, for lack of better words, clean this up, it's allowed to fester. And it's just like, you have a lot of people who are dissatisfied with their jobs because they're feeling like they're not being heard by their management. And, it's like, well, why should I even bother writing this up or complaining, because I've done it before and nothing has ever happened. So, in my experience of places where I've worked, I do my best to lead by example, because what happens is that, me being who I am and a leader in my industry, is that I have to teach people how to do this. And it's like leading by example. And I have a lot of people that I mentor at different places where there's issues going on of how the best way to handle this. And, sometimes you have to leave the department and raise that problem and put the upper management or upper administration on notice that this is going on. This is what's been trying to be done, and nothing has been resolved. They're being put on notice because I believe that there's a disconnect between the C-suite, the corporate part of the administration, and what's really happening down in the, I'm going to call it the minefields of where everything is happening. And, if they don't hear about it, they figure that everything's okay, when in essence it's festering. I also feel too that if you have management that does not support the staff, and maybe is abrasive, or even, I wouldn't say abrasive, but actually, bullying. I've witnessed that too, and it's not pretty. And it's like, for somebody who is very sensitive like myself, it's just the way things are said. You could feel what is really going on. And, you go into a staff meeting, a group meeting, and somebody is asking something, and, the management's belittling them in front of everybody. That's not cool, folks. That's like shaming. It's like, what is the, first of all, I ask, why are they doing that? Secondly, is it their management style? And if it is, that's something that's really outdated. And it's not appropriate. It's totally disrespectful to, a human being. What I find is really important for people just in general is that, there's 5 things that people, when they have these 5 things, I think they are thriving and doing more than is expected of them. The 5 things are: they want to be heard, they want to be respected, they want to be appreciated, loved, and valued for who they are and what they bring to the table. Because our workers, the people who are doing the work in the institution, are really, the most important people of the corporation, because without them you could never get anything done. But yet what we're seeing today is something that is not quite that. And so the other thing too is that when you have a disconnect between your lower management because of the shared governance model and the upper management that doesn't really know what's going on, that could be a setup for a real not so good situation. Because if there's bullying and, you know, things that are not being rectified that have been brought to their attention, that's actually a setup for a lawsuit. And if the higher ups aren't aware of this, are not put on notice or included into the conversation, sometimes I feel that that could be blindsided, and then they wonder why the morale is bad at the hospital's reputation is bad, and patients maybe, are suffering in the long run because of this. That's an interesting question too, because, the focus of every healthcare, you know, of every healthcare industry is the bottom line is the patient comes first. We're there to serve a person who's coming into our organization, maybe at their most vulnerable that they've ever been in their life, depending on what's happening. And we're there for being their eyes, their ears, their words sometimes, if they can't speak. I mean, we're their advocates, and we're there to, you know, to protect them, to value them, to appreciate them, to respect them, and to do what is the right thing by way of that patient. And for me, I speak from being in the operating room or, the theater setting, is that, we take care of patients there that are their most vulnerable. They're going under anesthesia, and they, are basically handing over themselves to us so that they could be taken care of. And for us, I think as clinicians and healthcare providers, is that it is our obligation to provide that. That's like the bare minimum that we should be providing for our patient. And so, I want to talk a little bit about, you know, energy. And, for some people who don't understand the concept of energy, everything in life is a frequency. It can be measured by, the vibration frequency. It's called energy. And our thoughts, our words, our beliefs, who we are is an energetic unit, basically. And everything that we've ever experienced in our lives, pleasant, unpleasant, good things, bad things, that we label, that is all part of our energetic makeup. How we deal with things is an energy. Things that we learn from our parents and our grandparents and in our ancestral lineage is all an energy, and that comes with you wherever you go. It's like everywhere you go, here you are. A lot of times people are very unaware or unconscious of this concept. It's like, how are you being? This is the energy that you bring um, into a room, into the place where you work. In my case, it's into the operating room. Are you the best version of yourself that you could be at that moment for that patient who's unconscious under anesthesia, getting ready to have surgery? Or are you so stuck and, doing not so great things and not totally 100% focused on that patient? That's a really important thing that people need to become more aware of, because what we know is that the energy can affect how that patient actually does. And I know this is a very on the fringes concept and a little maybe on the abstract side, but it's the truth. If you have an environment where there's a lot of negativity, patients don't do well. There's mistakes that happen, and the patient, who is supposed to be the priority of the room, ends up getting the detriment of that. So what I mean by this is that Even though you can't see energy, it's a feel thing. So is the vibe a positive one, or have you just had an argument with somebody in the room that you're working with and it's unresolved? That energy lingers, that patient picks that up, even though they're anesthetized and considered unconscious, they're still very present in the room. They're just not in their physical body. Okay. So that's really important. And to understand and to really, grasp that concept, because how we show up, positive or negative, has affects outcomes. It's like a ripple effect that goes into the room and everybody else is affected by it. Not only the patient, but your staff, people that you work with. I want to share a really interesting story because I think maybe this will help drive it home a little bit. It's like, say you have somebody who is so miserable that they're like, they hate their job and, everything's, they're always complaining, and they think, oh, I'm going to go across town to this other hospital that's way better and stuff like that. So they quit, they leave, they go to this other hospital, and it's like the same scenario for them. And so they're disenchanted there, and, they maybe move to another part of the country at another hospital that they, maybe they go traveling to or something or whatever they do. They end up at this other hospital and the same things are happening. They're very unhappy, very disgruntled and stuff like that. Well, wake up, everybody. What's the common denominator there? It's not the institution, it's actually the person. The person keeps recreating that same scenario because that's their energy and that's what they're creating. Something to think about. That's another interesting thing too. Yes. Sometimes when people are you know, maybe an argument has happened or the surgeon doesn't work well with the team or whatever, is that sometimes what happens is that, it's just that's there's that resentment there. And sometimes there's, maybe behaviors that are happening that are not appropriate, and it's a distraction. So it's like distracting a person from what they're truly supposed to be doing, focusing on the patient. So, I feel that when somebody gets angry, especially a surgeon, and starts, going down the rabbit hole, as I call, of, because whatever you continue to focus on, it gets bigger and bigger and bigger. And so, eventually what happens is that, you're almost in the land of no return, because you have, it's like what you focus your attention on, you create more and more of. It's that simple. It's the law of attraction. And so if you're focusing on how bad the day is and how you don't have everything you need and you're just really frustrated and stuff like that, you're taking away from that patient, and sometimes you create more and more problems and the patient suffers. Now, I had an instance with a surgeon personally, over the years, where um, she, I really never really enjoyed working with her, but I tolerated her, and did whatever. But me as being the patient's advocate, I was actually, um, I was strongly supporting. I was the patient's voice basically at the bedside there. And, the things that she was doing, I was questioning. I said, help me understand why you would want to do it this way when this is happening, because I've had a wealth of experience, um, with, certain things, certain specialties, and I'm very well versed in a lot of things. And, I always like to offer suggestions, especially when I'm not sure if the surgeon knows what they're doing. So it's like I kind of phrase it in a way. It said, "Help me understand why you're doing it this way," and see what she has to say. And then I may offer something like, "Well, I know that other people have done it this way, and with a better success." And so it's a way of speaking with the surgeon, or somebody who's not a parallel professional, meaning like another nurse practitioner, but like a surgeon or somebody who is in a different category. It's like you want to make it sure that it's their idea, but also it's multifaceted because I want to make sure that the patient's getting the best out of the situation than not. Well, unfortunately for this patient, there was many things that happened. She had she had a GYN procedure where she was being having her uterus removed for a huge I think she had a fibroid, and it was the size of a large grapefruit, and the surgeon was trying to deliver this vaginally without dissecting it up a little bit to remove it intact. And so what had happened was the patient's colon got pinched into the vagina as she was trying to pull this monster of a uterus out, and it shredded her colon. And unfortunately for this patient, um, she had to have another surgery to resect part of that colon and put it back together. And the surgeon was kind of the GYN surgeon was kind of oblivious to the fact that she was doing anything wrong. And so, I mean, I'm screaming. I'm doing what I can to, you know, energetically just work with this patient, but also to get some other help into this procedure because it was obvious to me that the surgeon was making really bad judgment calls. Something that should have been delivered abdominally through a small mini incision um, should have never been delivered vaginally without it being morselized, so it could come out a lot easier. So, long story short, is that because of that situation, I had to file some complaints and with the medical staff at the institution and write a formal letter because this was not the first time that I worked with this lady. I worked with her several times. In fact, I had no longer wanted to work with her prior to that situation. However, I was doing a colleague of mine a favor, and I didn't know that she was the surgeon that I was doing the favor for. So, note to self for me is just like, no more favors, and I don't work for with people who are not aligned with me and who I feel are not safe because that's me and that's my reputation, and I really support the patient. And I just can't be part of a situation like that. So that was the one thing that happened. And, the outcome of that is that she lost her privileges to practice. I also had to file a report to the medical board, and I did so so further exploration could be done and reviewed. It's not fun to do that stuff, but it's like, you know what? That patient was, my priority. I had to do what was best for that patient and maybe for the future patients as well. It's not pretty stuff, let me tell you. But sometimes you have to be the whistleblower on things because if you don't, you know, that's going to be allowed to perpetuate, and who knows how many other people could be wounded because of that or even die. So that's why it's really important. Well, and it's even more concerning too when there's a language barrier where the person doesn't even speak the language. And the surgeon also, there's a language, I wouldn't say a language barrier. English is not her primary language. So she speaks, there's like three different languages involved there. So I'm like, I'm almost wondering what she said to the patient because I'm sure, I don't care what you say, but it's just like whenever there's multiple languages going on, something always gets lost in translation. It's not 100%. So, I question that as well. So, and that will probably continue to be a concern, in the future until maybe someday where we all communicate telepathically and it won't matter. Absolutely, because the thing is that's your patient is your primary priority. And I think what happens for a lot of people is that, they're afraid of confrontation. And believe it or not, I'm sure a story. Up till age 30, I just feared confrontation. It was just like, you know what? I would rather ignore, move away from the situation and not deal with it than deal with it. And for me, it was actually more something had happened within me, and I just found my voice, I guess. And I'm very comfortable with confrontation because first of all, I feel very confident in what I know and my wisdom. Maybe that's come with age. However, I've noticed too that there's a lot of people in healthcare that are afraid of confrontation, especially if they work for an institution. They're afraid that they're going to have repercussions from, speaking up. They're going to be, especially if you don't like to be brought to the attention of others, you like to hide and stuff like that. That's another thing. Sometimes people would rather hide than be seen. But yet, what happens is that if there's situations going on and, you just continue to allow them to, it's like shame on you because you're the one that's allowing this to perpetuate, and if you don't speak up for yourself, nobody else will. So, there's a lot of facets that go into this. It's just like, okay, are you a very passive person? You don't like confrontation? Do you like to hide? You're afraid to be seen? Maybe you've had bad experiences when you've spoken up and said something where you got punished. It's just like, yes, we've all been there. I've been there too. I remember, doing a research project for my dissertation, and I wanted to do it with the orthopedic patients at this one hospital. And I spoke to each doctor individually, and they were on board. They were excited to do this. And yet, when I had those same doctors in a room together and I gave the presentation, I felt as if they all ganged up on me and they were throwing rotten tomatoes on me because none of them were, I think they were afraid what other people were thinking, even though they agreed with me as a group together. I think they were waiting to see how everybody else was going to react, and they all band together. It was a very eye-opening moment for me, realizing how people are. It's like individually, they may be on board, but when you get them in a collective group, they want to be part of the collective group and what's kind of happening within a group. And they all take on the behavior of what the group is taking on because they don't talk to each other beforehand. They just made a decision, and nobody wanted to be the outlier and speak up and support that. And I think we see this a lot in healthcare. It's like going along with the crowd, and whoever is the stronger voice, they follow behind it, even though they don't agree with it. It's like they've given their power away, as an individual, even though they don't agree with it, and they're afraid to speak up because they don't want to be the unpopular person. It's almost like being back in high school and grade school, where it's just like, you want to be part of the popular people, so you just follow suit, even though so you don't have your own opinion or your mind, because if it's counter to what is there, you're going to have repercussions and you're not going to be popular and all this other stuff. You understand what I'm saying? It's so petty, but this is what is a carryover too into the workplace environment. Well, I think first of all, they have to be aware that this is happening, because a lot of times they just think this is normal. And when you display when nurses or healthcare providers display, they lead by example. It's like these people start to wake up little by little. I remember one time I was in a surgical procedure, and the unfortunate thing was this guy, um, he was very young. He was probably in his 50s, was going to probably make his transition. Basically, we opened him up and he had a huge amount of dead bowel that was not viable. And so basically we closed him up, and we wanted to get his family in there. And the caveat to this was the guy had a daughter who was pregnant, and they didn't let the daughter know that her father was in the hospital having major surgery because they were afraid of her being pregnant and maybe miscarrying or whatever. But the bad thing was is that he was on his deathbed basically, and we were going to be pretty much closing him, putting him in the recovery room, and letting him, pass. And so, all these logistics were taking place while we were in the room, and the anesthesiologist wanted somebody to come in to do last rites. We were in a Catholic hospital, and the supervisor came in as if she had been there the whole entire time, which she wasn't. And she was saying, "Well, this is a Catholic hospital. They'll take care of it." I'm thinking to myself, okay. Um, and the logistics too were I wanted to get an anesthesia tech in there to get monitors so we could transport the patient from where he was in the OR to the ICU. Well, her response was, "We're just two doors down," and blah, 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 blah. And I'm thinking to myself, please get out of the room. And, she pretty much everything that I said, she had an answer for, and it was shaming. And she left. There was like 6 other people in the room with me. And I said to them, "I just want you all to witness the shaming that I just received from this woman. Okay, you're the witness to this. She was shaming me. I want you to know that." And I said, "That's not appropriate, but it will be dealt with later." I said, "Please go get an anesthesia tech." I said, "Please go notify the clergy." And she said, "Well, that's what I wanted to do." I said, "Trust your intuition. If that's what you wanted to do, you do it. You don't need permission from anybody. Please go do it." And so, what had happened was this woman came in and she kind of destroyed this whole situation, or was trying to destroy it. And to make something, I don't know what her gig was or whatever, but she wasn't even in the room. She had no clue what was going on. Instead of coming in and asking, "How could I support you?" This is what she did. So of course I wrote her up. And that wasn't the first time I wrote her up. I had a whole laundry list of stuff that I had been observing, and I just, continued to bullet point, bullet point, bullet point. And I said, "I know she's been talked to before. I haven't witnessed any changed behavior. When is this going to stop?" I said, "This was totally inappropriate that she came in and did what she did." And so also one of the nurses there, who is a little more soft spoken, she said, "Well, that's just the way she is." I said, "No, that's not the way she is. You allow her to act that way. That's on you. You allow this to happen. It's not because that's the way she is. You allow that." And I think it was an eye opener for her, but it was the truth. You allow this to happen. You could put a stop to this, but you continue to allow this to perpetuate. So it's about really allowing people, educating them, and letting them know what's kind of going on. Because sometimes, like I said, they're so used to it, they think this is normal and they don't have a choice. You always have a choice. It's you either choose to do nothing or you do something to change it. And I think it also comes to the point, it's like, how miserable are you really? Are you being triggered by things, but you ignore it and pretend maybe it'll go away? Or do you, get so frustrated that you finally seek somebody out to speak about it, to vent about it, and you take it to the next steps of like, how do I need to, what is the best thing I need to do? How do I handle this? It's okay to ask questions. It's okay to come to somebody that you trust immensely and just share what's going on, because there's people out there, believe it or not, that are willing to help you, but you have to sometimes ask. And sometimes that's a big thing because people don't like to ask for help, but know that help is always there for you. Absolutely. And, I feel like this is what I tell people: suffering is optional, it's a choice. You could either not say anything and suffer in silence, or just, or you could be proactive and, take a step forward, not only for your patient, but for yourself as well. Okay. The other thing to do also is, if something's going on in an environment that's totally unsafe, you need to let it's your or obligation to let your supervisors know that something's going on, number one, because they need to be made aware of it. Because if they're not aware of it, nothing can be done. And usually if you're in an organization where there is you have strong leadership and they are advocates for the department, it usually takes, they will take care of it and address it. When you have situations where you have management that's really weak and you're not getting anywhere with them, because, sometimes what happens is this, it's like a lot of times when people have been in a role for decades, it's like a stuck environment because there's been no new blood or no new ideas coming in. Because when you have people coming from other places, you get to share ideas and share experiences and share possibilities. When you have management that's been there for 20, 30 years, it's like it's stuck. Because rarely do they keep up with the times and are, it's like status quo. This is what's always worked. This is how we keep things together, blah, 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 blah. They're not open to anything new. Backtracking some more is like, if something does come up and you're not being heard, what you need to do is this, is I invite you to write everything down in a letter with no intention of sending it, but you need to write everything down. So it's like emptying your basket. So you have everything on a piece of paper in front of you. And then I also invite you to put it away for a day, go back to it the next day and reread it and reconform it. If it's feeling too, how can I say it? If it's feeling like it's very emotionally charged, do your best to dial it down so it's more coming to a neutrality, just stating facts like bullet points. Remember, keeping it short and sweet is always the best. Because a lot of times, people need the shortness so they're able to read that better too. Just so keep it bullet points, but also have somebody who you trust, who may be a senior member in your department, who, maybe there's people who are outspoken in your department too, or speak their mind or whatever. Look to them for leadership in regards to this. Or just ask somebody to read this for you so it sounds, it sounds like it's flowing, it sounds like you're stating all the points and you're not being totally emotional. And then I invite you to send it to management. CC it to yourself, but CC it to everybody in the management. And also, sometimes you have to step out of the department and include the C-suite and go up to the chief nurse officer and even the medical director, but even the CEO of the institution. So they are put on notice that this is going on. Especially if you have tried before within your department and have not been successful. I always like putting in the letters too that I know that this problem has been a problem within our department for a while, and I know that it has been addressed, but I have not witnessed any changed behavior. That's always a key thing, because that means that there's a problem there that needs to be further addressed. So, I don't know if management didn't really get their point across, or the person is just being defiant and not doing anything. But if there's no witnessed changed behavior, that needs to be put into the note as well. Now, I had to write up a surgeon who was really behaving badly at one institution. I had only been there for like 3 months. I was there as a traveler, as an assistant surgeon. And, I've been doing this type of work for almost 30 years as an assistant. And this gentleman was so rude and so condescending. He was the type of, he was a narcissist, basically. That's a polite way of saying what he really was. But of course, with him, it was all about him, and he thought he was the most important thing. And he was downright rude to the other staff and also the assisting staff that I'm part of. And I had to go in and relieve, and he was just a monster. And so I finally said to him, because I had worked with him 3 times prior, I said, doctor, I said, it's going to be hard to believe this, but it's really not all about you. And he just, was like, I said, look, I said, you're one of 50 surgeons in this department that we service. And I said, you know what? We cannot do things. You're expecting us to learn machinery that you're the only one that uses, and you find fault with it every time. I said, it's the most complicated thing I've ever witnessed. And I said, I don't have the time or the bandwidth to learn something new. And, it, I have other people that I need to, that are my priority as well. Of course, he didn't like that. And I said, I'm just going to be quiet for right now and we'll finish the case. And so I was. And after that, I wrote him up because I had enough evidence behind me with my 3 different encounters with him that, I always like to give people the benefit of the doubt. But when they have consistent behavior that is really toxic, something needs to be done. Well, what had happened was I wrote the letter and I decided that I'm going beyond the department, and I went straight up to the C-suite and CC'd everybody, medical staff and whatever. And guess what? It finally got addressed. It did, because of that. Because, the thing that really was really upsetting for me was this. When I came into work the day after I did that, the staff gave me a standing ovation, and I was annoyed and really pissed off because I was just like, I couldn't believe that they have allowed this surgeon to bully them the way that they had been for years and never done anything about it. And I was so disappointed, but I kind of realized that, oh my God, they probably don't know how to do this. So that's kind of opened up a whole venue to allow people to give them permission to do this and realize, okay, it's okay to do this. I'm sorry, a surgeon, a tech, a housekeeper, when we all cut ourselves, we bleed the same color. They're no different than who you and I are. Yet we're talking about, being treated with respect and being appreciated and honored. I mean, this is basic stuff. And when, for me, I mean, I don't allow people to treat me like this ever in my personal or my professional life. It's just like there's no exceptions. This is just not allowed. I mean, yes, it'll get addressed. It may not get addressed that day, but believe me, it'll get addressed. And sometimes out of those situations, believe it or not, you actually open the lines of communication with the person. Their behavior, they're probably not aware of what they're doing. A lot of them aren't, but they continue to do it because nobody's ever complained or they've never been called on it. So, what I'm saying to people is that, please write this stuff down, do something with it to move forward, because by you being a leader in that way, it's just going to help the other people in your department as well. But you're also teaching them how to do it as well, too. And this is what we need to do. We need to be nurturing and teaching each other these things, because nobody teaches us this in our nursing schools or in life. Sometimes we've all been in different life situations where we've had different experiences being raised by in different cultures, different countries, different parents. There's so much that goes into this that's like a matrix, but we need to come together and support our healthcare colleagues to know that they do have a voice and their voice does matter. Well, and the other thing I want to say too is, like, so many times people are unaware of how they're behaving. They're totally unconscious of it. And so the thing is like, sometimes when you make them aware of it, they actually thank you. I had another instance with another surgeon. I mean, it's just been one thing after another, but I'm like, I'm at a point in my life and my career where it's just like, I realize what they're doing has nothing to do with me. It's their stuff. I had this one surgeon who was like newly out of his fellowship. And, a lot of times when people are done with their training and they're in the real world and practice, it's like they're under a lot of stress, and it's a scary time for them because, you know, they're done. They don't have somebody watching over them anymore. And, they're trying to fit in to a new environment or a new role or whatever they're experiencing. And it's very telling for me when the newbies are, the people are done with their fellowship and they're the first 2 to 3 years, 1 to 3 years of their private practice. They're on their own, and they're a lot of times it's a scary time for them. And I totally get that. And sometimes you see a lot of behaviors coming out, like a lot of condescending things and the know-it-all type of thing. And that's like a coping mechanism, because they're projecting that onto, they're projecting a lot of the stuff that, onto other people that they actually feel about themselves. Do you understand what I'm saying? It's just like, sometimes, it's like they're trying to kick the dog, and if somebody takes a bite and takes it on for them, it's like a pressure cooker. It helps them decrease the pressure within themselves, but somebody else is being punished. It also affects patient outcomes, because they don't realize this too, because they're too young in their careers. So, a lot of times, you know, I've had to, have a, you know, I remember one time I was working with this young surgeon, and he wants to, become, a he's a robotic surgeon, but he wants to be like really known in his niche and stuff like that, and he's a director of a program. And, he wants to build a team, and something had happened one day where he freaked out over the dressing. Somebody put, steri strips and band-aids on his wounds, and he wanted the glue, and he totally freaked out. He came into the room, and he just, in front of room everybody, he just shamed the person to no end. And so I knew that I would have to address this, but I was going to address it in private, and to do it, the next time I saw him, for sure. It's like that little voice that keeps telling you, you need to do something, you need to do something. Listen to it, because it's important. So 2 weeks had passed, and I worked with this guy again, and we were at the scrub sink, and I said to him, you know what? I want to talk to you about what had happened a couple weeks ago. I said, I really appreciate the fact that you want to um, establish a team here to do, these type of surgeries. I said, but the way that you reacted the other day, that's no way to build a team. I said, it's not okay to go in and start shaming people. I said, it's like, I'm on you. I said, look, I said, I want to see you succeed. I believe in you. I know you have a lot of capability. I said, but please don't ever do that again. And he's over there. Oh my God, I didn't realize that I did that. I said, yeah, you did. And what was interesting from that actually opened the lines of communication between this person and I, and we have a great working relationship. And I consider him a friend of mine as well. But it's interesting how sometimes, when you just call people on stuff in a real, I call it heart to heart moment, it's not about making somebody right or wrong. It's just connecting with the person from heart space to heart space, because I knew the bigger picture of what was going on, and I could see it. And it was not directed at one person in particular, but him lashing out like that just really did not help. So the joke is now, when I work with him and he's starting to get amped up, I just reach across the table and grab his hand when we're working together, and I just grab it and he stops. Because it's just like sometimes they don't know that they're doing stuff. So, I mean, there's really good things that can happen out of this. It builds trust, it builds relationships, but it also, you know, it makes it more fun to work with people. And when we're having fun in the room, the patients always do well. you're absolutely spot on with that because they're it's almost like they've been in that environment for so long, they think it's normal and status quo, which is not. And so that's why I really embrace, I work at several different hospitals in, my state. And the thing is, every hospital has a different flavor. That's the way I describe it. It's like they do things differently a little bit. There's still, common threads that go from institution to institution. However, it's, when you have people coming in from different places, it's like sharing ideas. It's like cross-pollinating. It's like taking the new stuff from other places that are good and implementing it into your place if you're willing to do that. Um, and it brings new ideas and new ways of doing things. It's always a good thing. I think I think for a long time, many people would enter the job force and stay at one place for their whole entire career. And, for myself, I've been in healthcare well over 40 years. I never stayed in one place for a long period of time because I had the foresight that it was always good to gather experiences and then, go from place to place and, learn different things. I was just more of a seeker and a learner. Um, and for me, it was an enriching thing. So it's just like I got to see a lot, I got to experience a lot. I have a lot of ideas to share with people. For some people, that's not the ideal thing for them. They feel more secure and safe if they stay one place for a long period of time. And that's what makes everybody so uniquely different. The thing is that sometimes when you're stuck in an environment and it's like the status quo, it's like you keep going to work, you do the same thing over and over and over again, and the same things are happening over and over and over again. Yeah, you get immune to the fact that maybe something is not right. I totally agree. Well, this is interesting. I always, whenever I go to a new place, I always I always am open, friendly, and receiving. I'm very approachable. That's just who I am. I just, I'm here to support you, to help you, or whatever. I think what is good for a lot of people is just to take a step back and observe what's going on in the department. It's like, how does it feel? Watch, listen. You could hear what's kind of going on in the department too if you sit in the staff lounge. It's just like, I laugh because it's like sometimes the joke is, especially in surgery, is like, oh yeah, it's like every place has the same situations, but it's different faces. Do you understand what I'm saying? Every place has its issues. Sometimes they're the same issues, sometimes they're not, but it's the faces that change. Okay. So, some things are just, across the board that way, like times, getting patients in and out of their surgeries on time and, in the turnover time. But sometimes it's just the dynamics of who is the bully of the department. You could always tell who's the strong people in the department, who is a leader, who's not. You could tell a lot and you could just watch the dynamics. Sometimes it takes several weeks to kind of get it dialed in and just observe. I mean, what is the behavior? What is happening in the in the department? Are the managers or the supervisors, are they supportive? Is there good leadership? I mean, you could just make that assessment. You could just tell without having words exchanged. So, it's like to take an overall inventory and to see where the problems are. You sometimes it doesn't take long to tell. You could tell who are the bullies in the department and who aren't, who play nice in the sandbox and who don't. And the thing is that, if, so you're kind of prepared when you're meeting them. But I always like to give people, um, first impressions are always lasting. And the thing is I always like to give people the benefit of the doubt. If they do something once that I'm questioning, as long as it's not doing harm to a patient, I'll give them a pass. But if they do it again, I will probably say something because, one time, you might be tired and something happens, but it's just like they get a pass. And then if it continues and it's affecting me and what I need to do, I need to say something to them and, you know, do what we can to help this, become a better situation. A lot of times, like I said, people aren't aware of what they're doing. Some people really have negative attitudes and they have no idea that they're like, I call it Eeyore from Winnie the Pooh. Eeyore. It's just like they're always complaining, but it's just like they never do anything proactive to fix that. So, sometimes you have to say to them, it's just like, well, I hear you complaining a lot. What are you going to do to fix it? If they don't have a solution. Well, it's just like, okay, that's a choice. You can fix that, but you're obviously enjoying this. I think there should be. And, I know with everything that's happening globally right now, we're in, a 2-year span of a pandemic and it's everywhere. I think that the healthcare industry is kind of suffering a little bit because of um, a lot of healthcare providers are very dissatisfied right now, and a lot of people are leaving in droves. Either they've had enough of being in healthcare because they're not supported, and it's not feeding their soul like it had, or they woke up and realized that this is not what they want to be doing. A lot of it is, work life balance. I think we've had, with the pandemic, for some of the healthcare workers, I don't believe they were sent home. They were just put to work and overworked quite a bit. And then with all the mandates that have come through too, it's like we're slowly but surely taking away our own personal power, our sovereign power to make the right decisions for ourselves. So people are choosing not to continue on. So people are leaving because of that. People who were on the verge of retiring just retired early because they had enough. And a lot of people aren't going into healthcare, but it's not just the healthcare industry, it's across the board in every industry. So, what we're finding here, especially in the United States, is that we have hospital beds. They are not filled to capacity because we have no staff to man the beds. There's a difference between hospitals being overflowing in no beds and not having the staff and having the beds. Well, and then what I'm finding too is, in my little niche where I am in California, is that, and I know this is across the board as well, people are traveling from different parts of the country, maybe even the world, coming to the United States to take, temporary positions and being offered, a lot of money a week to take these positions. And there's nobody who's biting to take the positions because, I don't think it's a financial thing anymore. I think what has happened is that the staff has been just overworked for so long that they're tired. And as we know, when you're tired and you're overworked, it's a slippery slope because you are decreasing your immune system. When you decrease your immune system, you start getting sick. And when you get sick, you're no good to anybody and you need time off to heal and get better. However, a lot of organizations are penalizing people for calling out sick because, it's and even when they are sick, which is really it's sad too, because what do you want people to show up sick so they infect the whole department so they get sick because they're stressed out and they're overworking and their immune system's compromised? It's making no sense at all, really. So it's like I've never thought I'd witness the madness that I'm experiencing now. I don't know what the solution is. I'm sure something will shift and change. This is the fourth nursing crunch that I've witnessed in 40 years. It's always resolved before, but I don't think this one's going to resolve the way that we think it's going to resolve. I think something different will come out of it. I'm not sure what it is. I don't know if this is fixable. That's the conundrum that I think a lot of places and a lot of people are feeling. Personally, I've been offered, could you work extra? And I'm like, no, I can't. It's about setting a boundary. And I know what I could handle and what I'm willing to do. Um, and I do this without feeling guilty or remorseful. It's like I have to put myself as a priority. My health and wellness and well-being are number one priority, because if I'm not 100%, I can't take care of somebody else, and nor will I put myself in the position to do that. So that's a personal choice. So I think a lot of people are making some really tough decisions, and maybe waking up and realizing that they need to put themselves first, because nobody else is going to do it except them. Absolutely. I think this has kind of gone, I believe over the course of, the history of the last 40 years, it's like we've seen themes and variations of it, but it's like right now we're just into survival mode. And I think what happens a lot of times when we're in survival mode, those things, get brushed aside, and they're the most essential things. Your people that are working for the people that are working for the institution, your people who are running the show for your institution, those are the primary things. And I think, yes, for sure, there should be some type of coursework to help with that, or some training. And yes, it's a time and it's an investment issue, but it's a necessity as well, because we right now we're in react mode globally. It's like something happens and everybody, it's, I'm going to call it fear and react mode to better describe it, because when you're coming from fear and you're reacting, you'll never find a permanent or a more solid solution. It's only going to be a temporary fix. It's like slapping a band-aid on a wound, and then before the wound is healed, ripping that off with the scab, and it's still there. So it's like you put another band-aid on it. Another analogy is like for people who've been to the fair, there's this game called whack-a-mole, where the mole comes up and you have a mallet and you whack it, and then it comes up someplace else and you whack it. That's what we are doing in society and in healthcare too. A problem comes up, we just whack it, and then it comes up someplace else, whack it. So it's react, 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 instead of really sitting down and looking at a deeper level of what's really going on, and doing our changes from that area. It's like getting to the core issue of what's happening, and then with the hopes of making more lasting changes and creating more building a corporation on a more solid foundation with their people. And I learned, probably one of the most important things that I ever learned in my career was from a surgeon that I worked with several years ago, and he was a little younger than myself. And every time, no matter who it was that was in the room, he always said, "Thank you, I appreciate you." And it was from like the janitor all the way up to like the CEO. He just appreciated everybody, and it's just like the people just loved him, and they would bend over backwards to do stuff for them, because it was genuine appreciation that he was giving. And I was just like, whoa, this is impressive. And I said, I need to hang out with this guy a little more to learn more. But it's true. So it's just like, tell a person, thank you for being here. I appreciate you being here today. Thank you for making my day better. People love that. And when they are felt appreciated, they're going to do more for you than you could imagine. And he had everybody eating out of his hand, seriously. So, I mean, to witness that was a huge, huge epiphany for me of how important that it is. And it's not like I appreciate you. It's no, it's genuine. You could feel the genuineness and the authenticity coming from his mouth when he said that. It's that connection. Okay. And it's not an intellectual connection. It's like a heartfelt connection. You feel it heart to heart. So for me, he was leading by example, and for me, I learned so much from that. It was just like I had the utmost respect for the man. And and it was awesome because it's just like he was just completely 100% genuine when he said that stuff, and you could feel it. People are looking for, like, there's an ulterior motive there's that's human nature, but sometimes maybe there was in the past for some other people when they were given praise for something, it always came with strings. So it's about really looking at how they interpret things, because we're the surmise of everything we've ever experienced in our lives, and each one of us is as unique as a snowflake. So everyone is going to be completely different in how we perceive and deal with things based on our previous experiences, and stuff that we dealt with and not dealt with, and felt and not felt, and stuff like that. It's just our physicality is only the tip of the iceberg of who we really are. It's like we're a compilation of your emotions, your thoughts, your beliefs, your connectedness to yourself. That's all like more of an unconscious, under the water type of effect. You have the tip of the iceberg, that's the physical, but the rest of it's underwater. So we really can't see that, because sometimes it exists and it's all energy. It's a less form of energy, but it's there, and it runs the show of our physicality. And that's why, when you look at some people who have health challenges, like, maybe somebody who has diabetes, you know, they, um, they have a lot of internalized anger sometimes, and it's about not experiencing the sweetness in life. They have a lot of maybe things in their past where they've held grudges, or they've had a lot of not so pleasant situations, and how they dealt with them and compartmentalize that within their body is still energy. It hasn't been dealt with, so it's just running the show on an unconscious level, and it eventually comes out into the physical. And for that, maybe the end result might be diabetes. I don't know, but that's just an example of what happens for people. So yeah, so you have this whole cornucopia of different things coming forth, and sometimes it's looking for the common thread, because we all have I think if you could just people just need to learn to connect with each other from the most genuine parts of ourselves, and I call it like your heart space. If you are working with somebody who's difficult, I always tell people, just drop into your heart space and speak from your heart. Because believe it or not, when you're in your heart space, you're in the present moment. You're going to say the right thing. And sometimes you may not even know what's going to come out of your mouth. But when you connect heart to heart, just energetically imagine your heart connecting with a person that you want to talk to, and just speak your words to them. Magic happens. I witness this all the time. And it's sometimes it's not for the brave of, it's not for the weak of heart. You have to just know and allow yourself to drop there, and just not be afraid, and just take baby steps, and just say, hey, sometimes it's just like connecting that way and just saying hello. It's a game changer. It really is. I really appreciate that, and it's been such a pleasure to be on the Voice of Nursing. And um, if people want to reach out and connect with me, by all means, please go to my website. It's drdoloresfazzino.com. And thank you for listening. And just know that you are worth it. You're capable. You're loved, and you're appreciated.